Harold Frederick Shipman, often known as Fred, was born on January 14, 1946, in Nottingham, England. He was the middle child of Vera and Harold Shipman. His upbringing was modest but stable, with his father working as a lorry driver. Vera Shipman was a domineering figure in young Harold's life, instilling in him a sense of superiority and ambition. Her battle with terminal lung cancer, during which she received morphine to ease her pain, left a lasting impression on Harold. He was deeply affected by her death in 1963, when he was 17 years old. Despite this early trauma, Shipman excelled academically. He attended the University of Leeds Medical School, graduating in 1970. It was there he met his future wife, Primrose Oxtoby, and the couple married in 1966 when Primrose was 17 and pregnant with their first child. They would go on to have 4 children together. Shipman's medical career began at Pontefract General Infirmary in West Yorkshire. However, early in his career, he developed an addiction to the painkiller pethidine. In 1975, he was caught forging prescriptions for the drug and was fined, and briefly attended a drug rehabilitation program. Despite this setback, he was able to continue practicing medicine, moving to the market town of Hyde, near Manchester, in 1977. He joined a group practice, the Donnybrook Medical Center, before setting up his own practice in 1993. In Hyde, Shipman built a reputation as a hardworking and dedicated general practitioner. He was known for his commitment to making house calls, especially to elderly patients. This facade of a caring doctor allowed him to operate without suspicion for many years. However, his pattern of administering lethal doses of diamorphine, the medical name for heroin, to his patients, often justifying it as necessary pain relief, began to leave a trail of unexplained deaths. Suspicion began to mount in the late 1990s. A local undertaker, Alan Massey, noticed that Shipman's patients seemed to be dying at an unusually high rate and often in similar circumstances. Seated or reclining on a settee, fully dressed. Massey reported his concerns to Dr. Susan Booth, another local GP, who also found the pattern troubling. Dr. Booth raised the issue with the local coroner, who in turn contacted the police. However, an initial investigation in 1998 found insufficient evidence to bring charges against Shipman. The breakthrough came with the death of Kathleen Grundy, a wealthy 81-year-old widow and former mayor of Hyde. She was found dead in her home on June 24, 1998, shortly after a visit from Shipman. Grundy's daughter, Angela Woodruff, a solicitor, was shocked to find a new will that left nearly all of her mother's estate to Shipman, excluding her family. Woodruff alerted the authorities, suspecting foul play. Grundy's body was exhumed, and an autopsy revealed lethal levels of diamorphine. Shipman was arrested on September 7, 1998, and subsequent investigations uncovered a pattern of similar deaths. Shipman was charged with 15 counts of murder and 1 count of forgery. His trial began on October 5, 1999. During the trial, the prosecution presented evidence that Shipman had murdered 15 patients between 1995 and 1998 by administering fatal doses of diamorphine. He then falsified medical records to suggest that the patients had been in poor health. The evidence included testimony from relatives of the deceased, expert medical opinions, and analysis of Shipman's prescribing patterns. On January 31, 2000, Shipman was found guilty on all counts and sentenced to life imprisonment with the recommendation that he never be released. The trial judge, Mr. Justice Forbes, described Shipman's actions as wicked and unfathomable. Further investigations by the Shipman Inquiry, chaired by Dame Janet Smith, concluded that Shipman was responsible for the deaths of at least 218 patients, with some estimates placing the number as high as 250. The majority of his victims were elderly women, though he did not exclusively target this demographic. Harold Shipman was imprisoned at HM Prison Durham before being transferred to HM Prison Wakefield. On January 13, 2004, a day before his 58th birthday, Shipman was found dead in his cell, having hanged himself with bed sheets. The case had a profound impact on the medical profession and led to significant changes in the regulation and monitoring of doctors in the UK. It highlighted the necessity for stricter controls over the certification of deaths and the prescription of controlled substances. The General Medical Council, GMC, and the National Health Service, NHS, implemented reforms to improve patient safety and restore public trust in healthcare professionals. Shipman's story remains one of the most disturbing examples of medical malpractice and the abuse of trust placed in healthcare providers. It serves as a reminder of the importance of vigilance and accountability in the medical field.